Welcome. Today we're diving into the fascinating world of the lacrimal apparatus, the system responsible for producing and draining tears. This small but vital structure keeps our eyes moist, healthy, and free from infection. Understanding its anatomy and function is key to recognizing and managing various eye conditions. Let's start by exploring what makes up the lacrimal apparatus and why it's so important for our daily eye comfort and vision. Lacrimal apparatus is divided into two main parts, the secretory and excretory portions. The secretory portion includes the main lacrimal gland and accessory lacrimal glands, which are found in the conjunctiva. These glands work together to produce lacrimal fluid or tears, which are essential for eye lubrication and protection. The secretory portion ensures a constant supply of tears to keep the eye's surface smooth and clear. Next, we have the excretory portion, which includes the punctum, canaliculi, lacrimal sac, and nasolacrimal duct. After tears are produced, they travel across the eye and drain through these structures. The punctum acts as the entry point, leading to canaliculi and then to the lacrimal sac. Finally, tears flow down the nasolacrimal duct into the nasal cavity. This drainage system is crucial for preventing excessive tearing and keeping the eye's surface healthy. Lacrimal fluid, or tears, is more than just water. It's slightly alkaline and contains water, sugar, sodium chloride, urea, and proteins. Importantly, it also has lysozyme, an enzyme with bacteriostatic properties, and immunoglobulins like IgA, IgG, and IgM. These components help prevent bacterial infections and neutralize viruses and toxins, making tears a vital part of our eye's defense system. Tears are secreted into the conjunctival sac through 10 to 12 ducts from the lacrimal gland. They spread evenly over the eyeball, keeping it moist and comfortable. When tears reach the inner corner of the eye, they drain through the puncta into the nasal cavity. This process is essential for maintaining the health and function of the eye's external structures. Watering of the eye is a common complaint and can be described by two terms, epiphora and lacrimation. Epiphora refers to watering due to obstruction in the tear drainage system, while lacrimation means excessive tear production by the lacrimal gland. Knowing the difference helps in identifying the underlying cause and choosing the right treatment. Epiphora, or overflow of tears, usually happens when there's a blockage in the tear drainage system. Common causes include stenosis of the punctum, avulsion of the lower punctum due to age-related changes, obstruction in the canaliculi, tumors in the lacrimal sac, or various pathologies in the nasolacrimal duct. Identifying the exact cause is crucial for effective management. Excessive secretion of tears or lacrimation can be triggered by reflex causes such as foreign bodies, inflammation, dust, smoke, irritating gases, bright light, or eye strain. Emotional or psychological factors can also play a role. These triggers stimulate the sensory nerves, leading to increased tear production as a protective response. Acryocystitis is the inflammation of the lacrimal sac. It can be classified as congenital or acquired, with further subdivisions into primary, secondary, chronic, and acute forms. Congenital acryocystitis often results from failure in canalization of the nasolacrimal duct or blockage by epithelial debris, while acquired forms are usually due to infections or structural issues. In congenital acryocystitis, symptoms typically appear in the second week of life. Babies may show epiphora with or without a purulent discharge. If gentle pressure is applied over the sac, mucopurulent discharge may be regurgitated. Early recognition and treatment are important to prevent complications and ensure proper tear drainage. Treatment starts with lacrimal massage, applying firm pressure over the sac area and moving downward toward the nose. This helps open the blocked duct. Broad-spectrum antibiotic eye drops are often used alongside massage. If symptoms persist beyond 3 months, surgical probing of the nasolacrimal duct under anesthesia may be necessary to restore proper drainage. Chronic acryocystitis is a long-standing, often suppurative inflammation of the lacrimal sac, usually due to obstruction in the nasolacrimal duct. It's more common in middle-aged individuals, especially women and those from lower socioeconomic backgrounds. The main culprit is stricture or narrowing of the duct, often linked to chronic nasal inflammation or anatomical variations. When the nasolacrimal duct is blocked, fluid stagnates in the sac and can become infected by bacteria like pneumococci, streptococci, or staphylococci. The sac wall thickens and becomes atonic, leading to further obstruction. This cycle of infection and inflammation can cause persistent symptoms and increase the risk of complications. Patients typically experience watering of the eye followed by mucoid or mucopurulent discharge. Swelling over the sac area is common. In the catarrhal stage, there's mild redness near the inner canthus. As the condition progresses, swelling and discharge become more pronounced, sometimes leading to an encysted mucosal if both canaliculi are blocked. Chronic acryocystitis can sometimes be mistaken for conjunctivitis. To confirm the diagnosis, doctors look for regurgitation of discharge by pressing over the sac. In uncertain cases, a sac syringing test helps determine if the duct is blocked. Routine investigations and X-rays may be needed to rule out nasal pathologies. Initial treatment involves repeated sac syringing with antibiotic drops to clear debris. If this doesn't resolve the issue, surgical options like dacryocystectomy (DCT) or dacryocystorhinostomy (DCR) are considered. These procedures aim to restore proper drainage and prevent recurrent infections. DCT is typically performed in elderly patients or after an acute attack. The procedure involves local anesthesia, a precise incision near the inner canthus, and careful removal of the lacrimal sac. The wound is then cleaned, cauterized, and sutured for cosmetic healing. Postoperative care includes bandaging, analgesics, and antibiotics. A key drawback is lifelong epiphora due to sac removal. DCR is a nasal drainage operation, often chosen for young patients with chronic dacryocystitis. The procedure involves exposing and removing part of the lacrimal bone, then connecting the lacrimal sac to the nasal mucosa. This creates a new drainage pathway. Postoperative care is similar to DCT, but the goal is to prevent epiphora and restore normal tear flow. Acute dacryocystitis is a sudden, severe inflammation of the lacrimal sac, usually following chronic disease. It's caused by bacterial infections and leads to pain, swelling, redness, and sometimes abscess formation. If untreated, the abscess can burst, forming a lacrimal fistula. Prompt treatment is essential to prevent complications like cellulitis or even cavernous sinus thrombosis. Management includes hot compresses, local and systemic antibiotics, and anti-inflammatory medications. If an abscess forms, it's drained surgically. Once the infection is controlled, DCT may be performed to remove the sac. In cases of lacrimal fistula, complete excision of the fistulous tract and sac is necessary to prevent recurrence. Other conditions affecting the lacrimal and conjunctival regions include phthiriasis palpebrarum, pigmented nevi papilloma, and various cysts. Phthiriasis is caused by crab lice and leads to itching and redness, treated with medicated ointments. Pigmented nevi and papillomas are benign tumors that may require removal if they grow or cause discomfort. Cysts, such as implantation retention or lymphatic cysts, are generally removed if symptomatic. Limbal dermoids are yellowish tumors found at the edge of the cornea, often on the temporal side. They contain skin-like tissue, sebaceous glands, and sometimes hair. These benign growths tend to enlarge at puberty and should be removed if they cause irritation or discomfort. Early removal helps prevent complications and maintains eye health. Summary: diseases of the lacrimal apparatus can range from simple blockages to complex infections and tumors. Early recognition and appropriate treatment are crucial for preserving eye health and comfort. Whether it's a congenital issue in a newborn or a chronic infection in an adult, understanding the anatomy and pathology of the lacrimal system guides effective management and prevents complications.